Okay, so now we're going on with Anthony Stratford from Mind in Victoria is going to join us. Anthony is talking about employing peer workers and the common myths around that. Anthony is the Community Advisor of Recovery and Wellbeing at Mind Australia. Anthony uses his lived experience of mental health issues and recovery to inform his work, and is passionate that this should inform practice both internally and external of Mind. He is a visiting scholar of Yale University School of Medicine. Anthony is also an honorary fellow in the Department of Psychiatry and an honorary fellow in the School of Population and Global Health at the University of Melbourne. So welcome, Anthony. Thank you for joining us today.
Good morning. I also noticed with the talks that have gone on so far that there wasn't actually a definition of peer support given out, and so I thought I'd give you a definition from one of the great leaders, world leaders in peer support, Sherry Mead. And it is peer support is a system of giving and receiving help founded on key principles of respect, shared responsibility and mutual agreement of what is helpful. It is about understanding another situation empathetically through the shared experience of emotional and psychological pain. Sherry's actually been out here a few times doing training. And unfortunately, she's no longer well. So I thought I'd give you the next thing would be a brief history of peer support in this country. In the 1970s and 80s, the emergence of peer support and self-help organisations such as GROW, ARAFME, and eating disorders all were founded on peer support, but all in voluntary roles. None of them were paid roles. In 1993, the first consumer consultants were appointed at Rozelle Hospital. In 1996, that should read, the Understanding and Involvement project at the Victorian Mental Illness Awareness Council was held. In 1996 as well, in Victoria, in all areas governed by the Department of Health, consumer consultants were appointed. And in 2006, of course, we had the federally funded rollout of the Personal Helpers and Mentors program, which has just been extended for another 12 months. The FAMS program, as it became known, it was mandated that in a team of 5, the teams had to have at the minimum 1 peer worker. And I suppose that that was a real, kick-off for peers in this country. And in 2012, the carer support and mutual respite. So, as you would have heard Larry mention, he and I have co-chaired an international committee for about 18 months, I suppose, drawing up an international charter to protect the core values. If you recall, there was a photo or a painting that he had up there. That painting dated back to around 1782 to revolutionary Paris. In that time, Philippe Pinel was appointed as the medical superintendent, for want of a better term, of the Bicêtre Asylum. And there he met, before he went there, he actually wrote to the governor of the asylum, Jean-Baptiste Poussin, for a rundown of what was happening there. And in those days, people were put in chains and they were badly fed and they were beaten and everything, people like us, And what had happened was that Poussin had been an inpatient of the Bicetra, but as a general patient, not at mental health. And he'd come back and worked his way up to the role as governor. And when he was governor, he had all the chains taken off the people. They were, cleaned up. They were fed properly. Their nutrition was attended to. The people would be sacked if they didn't speak respectfully to the patients. And what's more important is that he employed past patients to work in the hospital. And he wrote to Pinnell about the effect that this has had on the atmosphere of the hospital. Pinnell, of course, was later to go on and be known as the first father of psychiatry. And also out of this and out of Tuke, who was dealing at the York Retreat at the same time across the Channel, was the birth of what was known as moral treatment, okay? And it was a moral way of treating people with mental health. So what we're talking about today is actually not new. As Larry showed you, that leading psychiatrist in the 1920s, Sullivan in the UK, it sort of popped up, between Pinnell's days and, the 1980s. It popped up again from time to time and then got squashed for various reasons, So what I can give you with the work that we've done on the Charter is the roles that we've identified for peers. Some of them are applied here. And I ask you, if you're not in a mental health area, but you're in, say, housing or whatever, just look down the list and see where it'd be appropriate to get this lived experience to help you do your work. So we've got a very extensive role here. We've got system changes, all right, with consultants, advocates and senior advisors. We've got service providers, and as you can see, there's quite a list there. Peer support workers, system navigations. These are people who, when you've been through a crisis and you're out of hospital and we've lost.
The microphone's not working. Right now, though.
When and you're out of hospital, the mental health system can be absolutely mind-blowing, and so peers, because they've got through this, they can use their experience to help you navigate this system. They hold support groups and link you with networks, mentor and coaching, practitioners, support in housing, support in education and employment, support in crisis, artistic, cultural and social activities, individual recovery, peer bridges, support during times of transition, and warm lines, which are phone support. In work that's been done, research that's been done before, is that it's been shown that some of the times that feed into isolation are after the close of day, and especially at night time and often at weekends. And so these warm lines, which operate after hours, serve a tremendous role. Peer bridges I'll come back to at a later slide. So there's it's interesting because often people keep on asking for evidence of things, and Larry's been gaining evidence around the effectiveness of peer support for over 20 years now. Pat Corrigan, who's coming out as a keynote speaker for this year's themes, Pat's the same. This next quote is from Julie Repper, and for those of you interested in the recovery colleges, Julie was the one who started the first co-production recovery college at Nottingham. It also might interest you to know that people such as Larry, Julie, Pat Corrigan, myself, and others in this field all have a lived experience. So we're all coming from the same platform, you know. So Rapper and Carter. Their research has shown literature demonstrates that receiving support from peer support workers can lead to a reduction in admissions for consumers. What PSWs appear to be able to do more successfully than professionally qualified staff is promote the hope and belief in the possibility of recovery, empowerment, and increased self-esteem, self-efficacy, and self-management of difficulties and social inclusion, engagement, and increased social networks. And Donahue and so overall, consumer-led services reported equally positive outcomes for their clients as traditional services, particularly for practical outcomes. The last major piece of research which I've been involved in at Yale is that where Larry wanted to identify areas that only peer support workers could bring to their role, right? And the two major areas that have come out of this, and there's a third, obviously, which the other two are totally reliant on. So the one that both of these are totally reliant on is the relationship, all right? A peer can build a trusting relationship very, very quickly, much more so than any other professional, because of the mere fact that they've travelled a similar journey with their peer that they're working with. And from this, what else has been identified is hope and modelling, the modelling of recovery. There's something that sort of gets to me a bit where you hear it often and you read about it often, where we give people hope. This is the system, this isn't peers in particular. We give people hope and we empower people. I disagree with both of those statements, because if we give people hope, we can equally take it away. And if we empower people, if we're the ones empowering people, again, we can take it away. We have to facilitate and mentor the journey of the people that we work with so that it's their hope and it's their empowerment, right? And they're in control of it. So, what are the better outcomes? There's decreases in the number of missed appointments, increased attendance in community and education, decreases use of long-term and high-end care, increases self-assessment of practical knowledge about resources and care coordination, decreases stress levels, and saves costs on hospitalisation. Now, an example of the save cost is that I'm a board member of the International Association of Peer Supporters, which is... Right, which is based in the States. Now, another fellow board member is a chap called Peter Ashton, who is director of Optimum Health. Optimum Health are a private health company, they're part of United Healthcare, which is the largest private healthcare company in the world. The exec director of INAPS sent me an email saying that Peter was employing hundreds of peer support workers. And so I contacted him and I said, "What's up?" And he said, "I'll send you our research." And what they'd found, that they were employing peers anyhow, but what they'd found, that if they employed peer bridges, which are peers that would start working with somebody while they were in hospital, all right, and then continue working with them for up to 6 months after they left hospital, that reduced the first month's hospital readmission rate by 91%. Which is staggering. And of course, Optimum's a private company, so this was huge savings to them. And then it came down, as Larry's figures showed, it came down the second and third months around 40%. But it's had a huge, incredible effect, and it's because I think it's because of the connection, that the peer can actually do. So, to speak briefly on the common concerns, and the reason I've said myths is that all of these have actually have evidence to dispel them, all right? And I was talking to somebody earlier on, and it's always amazed me because around peer support, people are always asking evidence, but I was talking to our Deputy CEO one day, Dr. Margaret Grigg, and I said, "I've noticed that people are asking for evidence. You get the evidence, and then they're really choosing on whether or not they'll use it, all right?" So, the common concerns, as you can see, are too fragile, become unwell, more sick days, etc. You can run down those lists. Faye has touched on some of those. So the questions, I suppose, to ask yourselves are, which of these do you feel your organisation will be most concerned about? Are there any other myths or barriers? And think of some of the difficult HR situations you have experienced, and were peer workers involved? And if you're not employing them, then it just goes to show whether you like it or not, you're going to have difficult situations, and generally they're not peers. So I suppose that's where I'll finish. I will get, I've got one more slide. I will get the Philadelphia research to you, or to the Commission, all right? So the top 4 indicators for success, this comes out in the Philadelphia research. Organisational readiness. You can't just employ peers, right? The organisation must be ready for it. And that goes from the top, from the board down, or for, the chief exec, whatever, down, all right? A very clear and concise position description, all right? Very good training, and that's about to be rolled out, hopefully. I think, is it April? Is that the first rollout? Janet, is it April, the first rollout of the Cert 4? Yeah, but the RTA, the first 3 modules have gone to...
Oh, that'll be released as
Right, okay. And as Larry mentioned, supervision. At the moment in Australia, we don't have the senior peers to do the supervision. So when you haven't got the supervision, peers to do that supervision, you need to have a situation where in their supervision by their team leader or their manager, their personal development needs to be far more focused on than their job, all right? So just finally to wrap up, no matter how complex things are or what we're involved in, it's always good to remember why we're here. And we're here for one very, very simple reason, and that's to facilitate, all of us, is to facilitate and mentor people's lives back to a good one. Thank you.